Hi everyone and welcome to RES 330, Advanced Critical Care Monitoring. During this course, we will be studying advanced cardiopulmonary monitoring practices in the critical care arena. Our focus will be on hemodynamic monitoring, ECG interpretation, mechanical ventilation, waveform recognition, looking at the graphic analysis of those waveforms, looking at diagnostic lab values, as well as imaging and capnography. Since you've been practicing respiratory care, many of you have identified that monitoring patients in the critical care setting is essential for delivering quality respiratory care and critical care. These monitoring tools aid in the accurate assessment and proper diagnosing of and for the treatment of our cardiopulmonary patients. By developing and utilizing hemodynamic monitoring, ventilator waveforms, lab results, radiologic findings, capnography, and the intuitive practitioner can contribute to the successful outcomes for their patients as they progress through their disease state. As you can see here, our reading books, our textbooks are going to be the Hemodynamic Monitoring 6th edition, Dana Oakes. And many of you are familiar with Dana Oakes, the Pocket Guide, phenomenal resource. And then again, we're going to look at and use our Clinical Manifestations and Assessment of Respiratory Disease 7th edition. I know that I talked about this as being a rented book for last semester for that one semester. I do apologize, we will be using this throughout. And I made that assessment over the semester, how we could use this for our advanced critical care monitoring. As you can see here, I've listed the competencies and performance objectives from which we have 5 student learning outcomes. And here is how our grades are broken up for this semester. Activity papers are worth 20%. Discussion posts are 35%. Quizzes will be worth 15%. And our final course project is 30%. So this is really super important. We got to get better as a program and also as a class. Our discussion post is how we can communicate with one another. So your initial post is due Thursday night by 11:55 p.m. And then after you've posted, you can respond to 2 other students by Sunday night, 11:55 p.m. You don't have to wait until Sunday. You can respond to whomever has already posted once you've posted your initial response. Please do use a spell check and include your references on your discussion posts. As for quizzes, we're going to have 2 quizzes, one in Module 3 and one in Module 5. And I've also changed some stuff with regards to the activity paper and final course project, which I'm going to briefly go through right now. As I've stated here, during this course, we will change the things up a bit and include the following activities in place of some of the typical research activity papers you've done in the past. The first, Module 1, you're still going to have a discussion post and activity paper. Module 2, discussion post, but this time you're going to have a article review that you're going to do, a 1-page article review on hemodynamic monitoring, as well as a not complicated knowledge check quiz on hemodynamic monitoring. I will provide paper links, not just a video link, but actual PDF files so that you can download it and use it when you're answering and trying to answer the questions for the quiz. I heard that as some feedback from the previous semester. Module 3 is going to be a discussion post and mechanical waveform quiz. Module 4 will be your typical discussion post and activity paper. Module 5, discussion post, but this time we're going to have a radiology findings and versus pathology quiz. Module 6 and 7, discussion post and activity paper. And then Module 7.5, you will have a discussion post just kind of giving feedback on the course and some of the projects that we did differently, as well as a summative project, which is going to be a PowerPoint presentation. I'm going to give you just a quick overview on what that presentation is going to be like. It's going to encapsulate the 7 weeks of the course, and I'm going to read this very quickly to you. Monitoring a patient in critical care settings is essential for proper care. As with all patients, accurate assessment and variables is indispensable for proper diagnosis and treatment of our patients. Utilizing hemodynamics, ventilator waveforms, lab values, radiologic findings, or capnography helps us deliver better patient care. So what we're going to do is that we're going to apply these results of monitoring in an effective way that permits successful outcomes for our patients. So what are you going to do? You're going to create a PowerPoint presentation utilizing the concepts of critical care monitoring that you've learned during the last 7 weeks. Your PowerPoint slides will include a title slide, introduction, case scenario slide, and then one slide for each week that evaluates the information that we reviewed in the course. Then you'll have a conclusion slide as well as a reference slide. I will be providing a sample PowerPoint presentation and a video explanation as to this assignment. This should be easier than the previous assignments. So I hope that you will find this enjoyable, and I look forward to working with you this semester. If you have any questions, please let me know, and God bless you and have a wonderful semester.